Welcome everyone. Today we're diving into a hot topic. Can pornography cause erectile dysfunction? Now this isn't a simple yes or no question. It's a contentious issue with studies providing mixed insights. Some suggest pornography may desensitize our sexual responses, leading to erectile dysfunction, while others argue it could boost sexual responsiveness. It's a complex web of factors we're dealing with here. Stay tuned as we unravel the facts and fictions surrounding this topic. Before we proceed, let's first understand what erectile dysfunction is. In the simplest terms, erectile dysfunction, often abbreviated as ED, is a condition where a man struggles to achieve or maintain an erection suitable for sexual activity. It's not about the occasional difficulty, but rather an ongoing issue that can cause self-confidence problems, relationship strain, and even stress. This condition is more common than you might think. It's been estimated that millions of men worldwide are affected, with the likelihood increasing with age. However, age isn't the sole factor. Lifestyle, physical health, and psychological conditions can also play a role in ED. At its core, erectile dysfunction is a vascular issue, meaning it's related to blood flow. When blood flow to the penis is inadequate, it results in difficulties sustaining an erection. But remember, it's not a standalone problem. Often it's a symptom of a more significant health issue like heart disease or diabetes, which also affect blood flow. Now that we understand what erectile dysfunction is, let's dive into whether pornography could be a possible cause. The link between pornography and erectile dysfunction has always been controversial. Now, this isn't about pointing fingers or laying blame. It's about understanding the complexities of human sexuality and how our behaviors may impact it. Let's dive into the heart of the controversy. Some research suggests that pornography can indeed lead to a desensitization of sexual response. Picture this. You're consuming an intense, visually stimulating form of erotica regularly. Over time, your brain might get so used to this high level of stimulation that real-life sexual encounters just can't measure up anymore. As a result, you may struggle to maintain an erection during an actual sexual experience. This is essentially the desensitization theory, but hold on, the plot thickens. There's another camp of researchers who argue that pornography might actually help with sexual responsiveness. Their argument is that exposure to erotic visual stimuli could potentially enhance sexual arousal, making it easier to achieve and maintain an erection. So, who's right? Well, that's where things get tricky. You see, both sides present valid points, but they also seem to contradict each other, right? This is why the debate continues. The human body, especially when it comes to sexuality, is not a simple machine. It's a complex system influenced by a myriad of factors, from our physical health to our psychological state. And let's not forget, we're all unique. What might negatively impact one person's sexual health may have a completely different effect on someone else's. This is why it's crucial to remember that everyone's experience with pornography and its potential effects on erectile function can vary greatly. Clearly, the relationship between pornography and erectile dysfunction isn't straightforward. What we can agree on, though, is that more research is needed to fully understand this complex issue. Until then, it's important for everyone to monitor their own sexual health and seek professional help if they notice any changes or difficulties. While the controversy continues, let's not forget that there are other factors at play too. Relationships, for instance, play a significant role in sexual health. Stress and strain in a relationship can lead to emotional distress, which can, in turn, affect sexual performance. Communication is key in addressing these issues. Open dialogue about sexual needs and concerns can significantly improve sexual health and function. Body image is another factor that affects erectile function. Men who are unhappy with their physical appearance may struggle with feelings of inadequacy and insecurity. These feelings can cause anxiety and stress, both of which are known to affect erectile function. It's important to remember that everyone's body is different, and there's no such thing as a perfect body. Embracing one's own body can help in alleviating these anxieties. Mental health, too, is a significant player. Conditions like depression, anxiety, and stress can all lead to erectile dysfunction. It's not just about the physical, but also about the mental and emotional. If you're struggling with mental health issues, it's crucial to seek professional help. Therapies like cognitive behavioral therapy can help manage these conditions and in turn, help manage erectile dysfunction. Let's also discuss lifestyle choices. Habits like smoking, excessive alcohol consumption, and lack of physical activity can contribute to erectile dysfunction. These factors affect blood flow and overall health, both of which are crucial for sexual function. Leading a healthy lifestyle can go a long way in preventing and managing erectile dysfunction. Lastly, underlying health conditions like heart disease, diabetes, and high blood pressure can also lead to erectile dysfunction. These conditions affect blood flow to the penis, making erections difficult to achieve and maintain. Regular checkups and managing these conditions can help in preventing erectile dysfunction. As we can see, erectile dysfunction is a complex issue with many contributing factors. But what does this mean for individuals experiencing sexual dysfunction? Well, the answer lies in the importance of non-pathologizing treatment approaches. These approaches are crucial because they address both the physical and psychological aspects of the issue. First, let's understand what non-pathologizing means. It's a fancy term that essentially means not treating a problem as a disease. Traditional medical approaches often label and categorize conditions, which can lead to a sense of shame or guilt. But non-pathologizing treatment approaches see things differently. They look at the person as a whole, understanding that their experiences, relationships, and mental health all play a part in their overall well-being. In the context of sexual dysfunction, this comprehensive view is vital. Why? Because it's not just about the physical. It's also about how one perceives oneself, one's relationships, and even one's mental health. For example, someone struggling with sexual dysfunction might also be dealing with body image issues or relationship stress. In such cases, merely treating the physical symptoms won't address the root of the problem. Non-pathologizing treatment approaches, on the other hand, aim to understand and address these interrelated factors. They offer a more holistic solution, one that goes beyond just fixing the physical. This could involve counseling, therapy, or even lifestyle changes. It's also worth noting that these approaches encourage open communication, understanding, and empathy. They promote self-acceptance and reduce the stigma often associated with sexual dysfunction. This can help individuals feel more comfortable seeking help, leading to better treatment outcomes. However, as crucial as these non-pathologizing treatment approaches are, it's equally essential to remember that they are not a substitute for medical advice. If you're experiencing issues, it's always best to consult with a healthcare professional. They can guide you to the appropriate treatments and resources, whether they be medical or psychological. Remember, it's important to seek help and not to self-diagnose. After all, every individual's journey with sexual dysfunction is unique, and the most effective treatment approach is one that respects and addresses this complexity. So, can pornography cause erectile dysfunction? The answer isn't as simple as yes or no. As we've seen throughout this video, the relationship between pornography and erectile dysfunction is a complex one. It's not a simple cause and effect relationship, but rather, it's a dynamic interplay of various factors. Some research suggests that excessive consumption of pornography may desensitize sexual response and contribute to erectile dysfunction, while other studies suggest that it might actually aid in sexual responsiveness. Remember, erectile dysfunction is not just about physical factors, it's also about psychological and emotional factors. It's about how we perceive ourselves, how we perceive our bodies, and how we engage in our relationships. It's about our mental health, our stress levels, and our overall well-being. This is why it's so important to approach this issue from a non-pathologizing perspective. It's important to understand that experiencing erectile dysfunction doesn't mean there's something wrong with you. It's a common sexual challenge that many men face, and it's something that can be addressed with the right help and support. If you're experiencing sexual dysfunction, it's crucial to seek professional help. Talk to a healthcare professional who can help you understand the issue better and guide you towards the appropriate treatment. Whether it's therapy, medication, lifestyle changes, or a combination of these, there are many ways to address erectile dysfunction. In conclusion, while pornography might play a role in erectile dysfunction for some individuals, it's not the sole or even the primary cause. It's just one of many factors that can contribute to this common sexual challenge. So, whether you're a consumer of pornography or not, it's important to maintain a healthy relationship with your sexuality and seek help if you're facing any sexual difficulties. Did you know this before? Share your thoughts in the comments below. Don't forget to like, share, and subscribe for more insightful videos like this. Until next time, take care.